Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care, and with me today is radiation oncologist Dr. Perez-Tamayo. At Central Care Cancer Center, we are dedicated to keeping expert cancer care close to home. We have state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, maybe just a second opinion, access to clinical trials, financial counseling, or other supportive services for yourself or your family, even genetic screening for cancers, Central Care Cancer Center is here for you. At any time, feel free to email with questions or comments to askdoctor@cccancer.com. That's askdoctor@cccancer.com. Today, our discussion centers around men. And Doctor, I could say a lot about men, but specifically, we're going to talk about cancers that affect men, such as prostate, bladder, and genitalia-related, penile and testicular. So we've had a booth, Doctor, as you know, at various events and fairs, and we have these models set up so you can feel and actually see what cancerous lumps are like. And one of the displays that we have set up is on the prostate. But it never fails that we'll have women come up and ask a question or even question whether females have a prostate. And the answer is no. Men get all the prostate issues. And it's the most common cancer in American men besides skin cancer, right?
That is right, Leanne. And interestingly enough, I'm glad women are coming by because invariably, and we've been setting up these booths for years, I see more women interested in behalf of their husbands or loved ones about cancers of the prostate in particular, but of course of all, than men, even though in 50% of men will have some kind of beginning of cancer of the prostate after 70. So that's a lot of men. Now, many people read, oh gosh, something else is going to kill you than cancer of the prostate. And these studies that do say these things, because it is something that is said, are actually on very older men, and most of them are not from the United States. They're European studies. And what happens is that if you are 90, you are most likely going to die of something else. That is very true. But if you are young, and especially you're in your 50s and even 40s, and you have a cancer of the prostate, usually it's a familial cancer. They act very differently. They can actually grow very quickly. They don't behave the same way as another person that does not have a family cancer, prostate cancer. And then there are 10 types of or Gleason scores from 2 to 10 that will give you how severe or how aggressive the cancer is. You can have a very early cancer, meaning stage 1, but a very aggressive cancer, meaning Gleason score of 10. And what Gleason score is a score, which means it's an addition. It gives a big, the first number is 1 through 5. It's a grade given to the majority of the cancer. And then the second number is the minority of the cancer, which is given a second grade, 1 through 5, and then those are added up. So if you have a grade of 5 and a grade of 5 in the minor and the 5 in the major, you have a Gleason score of 10. And those people die within 2 years. So it's not a slow-growing cancer. It's a very, very fast-growing cancer, one that usually travels in the bloodstream and it goes into your bone. Now, even if you have a middle-of-the-road cancer, which is kind of a Gleason score of 7, it can be the major pattern can be a 4, or it can be a 3, and the minor pattern can be a 4 or a 3 to give a 7. So you can see the 7 is a number that be composed of 4 plus 3 or 3 plus 4. But the first number is the most important number. That means the majority of your cancer is a 4 out of 5, which means aggressive. And if it's bulky, meaning it is involving both lobes, which is usually what happens, cancer is not of the prostate usually doesn't grow from one spot and then it goes into your prostate just by contiguity. It actually starts in the prostate in different places at the same time. What does that tell you? It tells you that your prostate, by virtue of age usually, but for other reasons like the family genetics, is going bad. the cells are not behaving. So you need treatment, or you're going to have this cancer take over the surrounding structures, which is your rectum and your bladder. So the prostate sits in the middle of your rectum and your bladder, like you would think of an Oreo cookie, the prostate being the filling. And even though it may not kill you in some cases where the Gleason score is low, like 6 or less, it can go into these two organs and you will have obstruction, meaning you can't urinate and you cannot have a bowel movement. And that is a quality of life issue that is very, very grave for many people that are older. Because if you can't have a bowel movement and you get obstruction, it becomes painful, and even, you have to maybe have a diversion or a colostomy because you can't urinate or you can't, have a bowel movement, or you may even have a catheter because you can't urinate. Likewise, if it travels in your bone, again, it may not kill you, but it can make your bones brittle and break. I have men that actually try to sit up from a chair and they fracture an arm, just on the fact that the body's, the torque or the stress of the weight on a bone that has a spread or metastasis of the prostate can give it kind of a jelly-like or instability that is very soft and it just breaks. And then you have to have surgery, you have to have treatment for something that could have been preventable. And so as one grows older, you have other issues that just happen with age. Prostate cancer in an older gentleman can actually become a quality of life barrier that can make you not be independent and have difficulties even just getting up. So I urge people not to be complacent, because the treatment is very successful, whether it's surgery or radiation, and it's almost 100% curable. So why in the heck would you want this to travel?
That's right. So what does the prostate do, and do you need it? Do men need it if they have prostate cancer?
Well, that's a very interesting question, because I would tell you that probably 99.9% of the patients I have don't have a clue of what the prostate does. The prostate is what makes part of the semen, or what makes actually the sperm become fertile. Without a prostate, it's very difficult to fertilize an egg. And in fact, the prostate is the most manly part of your body. Women can have testicles, but they cannot have a prostate. A man can have ovaries, but they cannot have a uterus. Uterus distinguishes a woman, and prostates distinguish a man. And unfortunately for men, the prostate is like a donut, which circles the outflow tract of your bladder. So if you have anything, even benign growth of this organ, which happens after 40 on all men, what will happen is your bladder, to try to deliver urine outside your body, will start to squeeze against resistance, which is your prostate, and start growing muscle, because the bladder is a muscle. So what happens to muscle that you do, like your resistant or weight training, you grow muscle. So the bladder, instead of a nice balloon that is able to expand and deflate like a balloon, it becomes a rigid, muscle-bound, bag. So instead of a nice filling vesicle that is able to expand as you need it, it becomes rigid. I don't know if people have seen those wine bags that some of the shepherds used to use for drinking wine or water. It cannot really expand very much, and it also cannot empty very well. There's always some residual urine left. So you're stuck now with this huge muscle, small capacity bag that you can't prevent by not letting this bladder get, strong, because it is fighting the resistance of the prostate that may not be cancerous, but all men's prostate, all will grow in time. Now, sometimes very little and sometimes very much. In fact, usually we associate the size of the prostate to appropriate for age as, like anything beyond 50 cubic centimeters is becoming a large prostate. And then it starts, instead of being a hat on top of your head, it becomes a bonnet. The bladder then drapes from around the prostate, or the rectum drapes around the prostate, and it starts causing problems of indentation of the prostate into these organs. Now, if it's cancer, it will actually grow into your bladder easier than it will do it in the rectum, but both of them can be affected.
So again, can you remove that prostate then? Or
yes. You don't want to make it so it's impossible for the surgeon to remove it because it's the size of your head.
Right.
So you don't want a head in your pelvis. A man's head, the man's prostate should be the size of a ping pong ball. And you can imagine a man's pelvis being like a Dixie cup. It's pointy. So any little growth at the very bottom of a pointed or a cone is going to cause you some kind of indentation of the organ. So you don't want it to grow too much before it becomes an issue. Now, there's medication these days that can make your prostate shrink away when it doesn't have cancer, and you will then not have the bladder start fighting it. So the prostate, and this is why we're taking more time on this subject, because it is really the number one cancer in men, and one that can be highly curable, one that you can have surgery for if it's small enough, or you can have radiation with equal success. Now, why one would choose one or the other, sometimes it's a matter of choice. Sometimes it's a matter of where the cancer is. If the cancer is involving the bundles of the nerves, which happen to be at the very bottom of the prostate, that can give you incontinence or impotency in erectile dysfunction, people may choose not to have surgery and choose radiation instead. I am not an advocate for what they call nerve-sparing surgery, because when you spare the nerve, which is inside the prostate, you're sparing prostate. And we have a lot of people with recurrences. Not that we can't salvage them. We have men that have surgery thinking they have a very early cancer, and it happens to be later or more involved than anybody dreamed. And we can then treat the patients with surgery and cure them as well. In fact, almost uniformly, you can cure a cancer of the prostate when you have surgery that is incomplete because of location or unexpected features. Now, if you have a huge prostate, you may limit then the choices you have, because surgery is really just limited to something that will give you function, meaning your bladder works and your rectum works. If it's invading or so much impacting both of these organs, that option is out. Now, the days of open prostatectomies are pretty much over. We do a robotic surgery, which is almost, I always say, a drive-through, because people stay in the hospital almost just one day and they're gone. They go home. Yes. Now, you do have a catheter many times that you have to wean yourself from, and some people have a little bit of incontinence after the surgery, which can be relieved with some exercise, or just time will heal it. So most people do well. And here again, it's not a huge problem to know that, you wanted just to have the surgery alone, but, without anybody's knowing it, you need more because there was extension outside the prostate. Since cancer, the prostate can be like bindweed. You can have roots that you never quite recognize at the beginning. Now, if you have cancer that is wild, like a Gleason 9, a Gleason 8, a Gleason 10, these days we really don't do the surgery, but we do a hormonal ablation, meaning we take away what makes the cancer grow, which is the androgens, or the male hormone, and we let it kind of seep in, kind of let it weaken up, and then we give radiation. And there's the Journal of American Medical Association show that with men with Gleason scores of 8, 9, and 10, if you do it this way, you have a 10-year survival benefit. So you need to do it in the right sequence. It's not nilly-willy, and it's sometimes not a smorgasbord. Some men want to choose and pick. And for some men, and most men, you can have choices. But sometimes the choice are limited. The right choice needs to be discussed rather than the choice that you want because you don't want surgery or you don't want radiation. Sometimes you need to do one or the other in a better choice, or both.
Let's take a quick break here, because when we come back, I want to talk a little bit about the symptoms for prostate cancer, or at least the screening options even, and then also get into a little bit of bladder cancer. I know that since they're right next to each other, we can talk just a little bit further about cancers that are taking place in men. We'll be right back. Welcome back. Again, I'm with radiation oncologist and president of Central Care Cancer Center, Dr. Perez-Tamayo. We're talking about cancers that affect men. And Doctor, in this last segment, we were talking about prostate cancer, of course, but I wanted to ask you, do men face fertility issues when it comes to prostate cancer?
Yes, with most cancers, there's some fertility questions, especially for the young men, that need to be addressed right up front. In the case of prostate cancer, it's about the ability to have the sperm be fertile so that it can fertilize the egg, and also the questions about impotency. Now, in fact, Celine Dion, the famous singer, her husband was older and did get cancer of the prostate, and for that reason, they wanted to have children. He did not choose surgery so that he could be able to have children, which he did. So that is one of the questions that if you're a younger man, you need to answer. But the ability to have erections can be changed with surgery or with radiation, most likely with surgery, much more than the chances with radiation. But it has to do with location of the cancer. If the cancer is located by the nerves that actually function your penis, well, then you're going to have erectile problems, because erections is a function of, it's a hydraulic lift, basically. And if you're not able to have we call it tumescence, or the ability to have the pressure, the water pressure, to have a functional erection, men, please note this, functional. Many men, because they have an erection, think that it is functional, but that's not the case. You can have an erection and then not be functional. So when people ask you about this, you need to be very honest about what kind of erection you're having, because we need to know where you are at the baseline. And then from there are things that can be done to make it functional, or to make it so that you're satisfied with your quality of life, because there's many options these days. So and then incontinence is another issue. We have many men that have dribbling already, but for some reason they don't recognize it. I ask them a question and the men go, "Oh, no problem." And the woman is saying, "Yes, you do, because I wash the clothes." So we have this issue all the time. Incontinence of urine and incontinence of stool needs to be evaluated in a way that we can have foundations.
What about screening? I know that there's the PSA marker, but there's also, they should have a digital rectal exam as well. But what is the doctor feeling for when they do that?
Well, first of all, they are complementary. One does not substitute the other. You can have a PSA that is completely normal and have cancer of the prostate, and you can have a PSA of in the thousands and not have cancer of the prostate. So they're complementary. Now, what the doctor feels is, imagine you're feeling through a gloved finger a walnut, because it feels like a walnut, and you're feeling one side of the walnut, you're feeling the edge of where the halves come in together, and then the other side. If you cannot feel the edge of where the two shells come in, or the edges of the shell, that's when we have alarm, because we call that effacement, meaning that for some reason the cancer has gone outside and we no longer feel the exact shape of the prostate. Now you can also feel nodules, which is very common, induration, meaning like swelling, or we can have firmness that should not be there. The prostate feels much like your nose. And if there is a pimple on your nose, you can feel it. That's exactly what it feels like.
That is so amazing to think of it in that terms, that you feel your nose. And that's just like with our model too, because that we have at the booth. You have what it looks like, and then up to stage 4 cancer. But you can see that you're right. It does. It looks somewhat, like a walnut, that size at least.
Well, and if you put like a Kleenex up your nostril and then you can feel your nose, it feels like it's fat or grown, or you don't feel the shape of it. And that's what we're looking at. And actually, I do something that is done in Memorial Sloan Kettering Hospital in New York, and I examine men like a woman in a pelvis, because here this kind of enters not only the prostate. I can feel the prostate better. I can also feel the bladder, which is a way of feeling if there's cancer in the bladder. I can also see what I call the panoramic view, which means I'm able to see the skin in the crotch region, which can have melanomas. I can feel the testicles, I can see the penis, and feel the penis. Because all of these are bits and pieces of a man's genitalia that need to be examined, including the kidneys. I don't feel the kidneys this way. In fact, nobody can. But the kidneys are part of what is considered the genitourinary cancers of men, and in this case also women. But the cancers of the kidneys are silent. So when you do a urine analysis, and this is our all men, please, if you get anything out of this talk, is know this, that if you have a UA or a urinary analysis and it has blood, it is always abnormal in men, always. So please ask for it by name. In your exam on a yearly basis, there should be a urine analysis, and if you have blood, it needs to be further investigated.
Let's go into the bladder, since we kind of talk, and we appropriately called it the hat, essentially, for the prostate, but it serves more purpose, of course, than just storing urine, because if you do have bladder cancer, it could definitely spread, to your lymph nodes, the bones, the lungs, the liver, correct?
Yes, the bladder cancers are very different cells than the cancers of the prostate. They're called transitional cell carcinomas. Why transitional is because the cells are between different cells. They're between lining cells and covering cells. The cells of the bladder that are usually cancerous come from people that smoke for the most part. There is a schistosomiasis or a liver fluke or a parasite that can cause cancer of the bladder, but it's usually seen in tropical areas in Egypt and other areas. And those are not the ones we're talking about here in the United States. And the cancer is actually different. Usually cancers of the bladder are transitional cell carcinomas due to irritation. And the irritation usually is because of smoking. Now, it can be other irritations, but mostly smoking. We have seen a little bit of increase in HPV positive bladder cancers, which means the human papillomavirus, which is a sexually transmitted disease. That can also give you cancers of the penis and penis urethra. The human papillomavirus affects the basal layer, or basically any kind of mucosa or covering of the bladder, penis, nail, eye. I mean, you name it, it can do it if it's a covering of an organ. So we are seeing more of that. Bladder cancers are a little bit more tricky because they usually do not bleed. Actually, bleeding comes from usually cancer of the kidney. You can have them when you with bleeding, and that could be a sign, or it could be pain, or it could be due to a bladder stone. But if you smoke, you need to have your bladder checked. Interestingly enough, how do you stage a bladder cancer is through a rectal exam done in a pelvic position. You need to have that to be able to see if there's induration, in other words, if there's inflammation. In cancers of the bladder, the earlier we treat them, the higher the chance that you can keep your bladder. However, the location is key to what kind of surgery or what kind of sparing of your bladder can be done. So when we look at the bladder, if you can imagine a balloon, if you look at the neck of the balloon, right there is a bad place to have a cancer of the bladder, because really there's not a lot of salvage. If you have it at the dome, in other words, at the very top, the round part of the balloon, you can get the bladder removed there with a small piece removed and call it good. And you still have a bladder that may be less in capacity, but still functioning. If you have a cancer that is down in the trigone, well, right there is where the bladder starts getting into the prostate, and it becomes rather complicated. Sometimes we have to do radical cystectomies, or removal of the bladder with a diversion, meaning that there is instead of a colostomy, you would have an ileostomy where you'd have the urine diverted on the side. Now, sometimes we can do bladder conservation using chemo and radiation, and then we can actually have you keep your bladder. We have had many people here in Kansas, in fact, people that you probably know because they are in politics, which we've treated, I've treated personally, and I have been able to keep their bladder. So some people, if they get it early enough, can have this bladder conservation treatment. Again, early is the key word.
Always early. Well, let's take another break here, and when we come back, we'll get into cancers that affect men's genitalia. You're listening to the Talk of Emporia with Central Care Cancer Center. We'll be right back. Great to have you back. Yes, I'm Leanne Powers with Dr. Perez-Tamayo from Central Care Cancer Center. And we've been talking about cancers that typically affect men only. And that, of course, goes for men's genitalia. Well, let's talk about penile and testicular cancers, too. And I'm sure a lot of men are going, oh, boy, especially if they listed this. They're blushing or they're embarrassed. And there is no reason to be embarrassed when it comes to these kind of topics.
Absolutely. And in fact, testicular cancer mostly happens to young men. So we're talking about seminomas or non-seminomatous cancers. These are in young men, meaning in their teens or 20s, 30s, sometimes in their 40s. And usually it just feels like there's a little knot in the prostate that shouldn't be there. It's easy to detect. It's easy to cure. Even when it spreads, it's easy to cure. So getting an exam and being in charge of your own destiny is key. Most of the young men, fortunately enough, are not embarrassed by coming and saying, hey, what's this? What is this? They are not liking a knot. And it sometimes, most of the time, it doesn't hurt at all. It's just a firm knot. It feels like it can be as small as a bean, or it could be as large as your thumb. And, there's something wrong. Or you have actually growing nodes. There's, you feel, and those can be painful. So to get that diagnosed, because it is so curable, is key. Now, just like anything, there's two cancers that can be any part of your body. One is melanoma and one is lymphoma. The actual scrotum or the sac where the testicles are can have a melanoma and can have other cancers. By a freckle that just happens to be there starts growing, or in the crotch region between your testicles and the anal area, there could be a melanoma. So if you have someone look in that area, if you can't see it, then you need to take a picture and make sure that it doesn't change. In older men, however, if you're 50, 60, 70 years old, a mass in the testicle is usually synonymous to a lymphoma. Now, lymphomas in most other parts are highly curable, and this is also highly curable, but it's more aggressive. So again, finding it early is key. Not usually a cancer of the testicular cells, but actually of the in-between cells is a lymphoma. Lymphoma is from lymphocytes. And for some reason, this is the number one cancer in the testicles of men that are 50, 60 years of age. So again, it's something to look for. Now, I have been one of the few that have written on cancer of the penis, because you don't have to have a penectomy if you catch it early enough. It is a cancer that can be rather aggressive.
Explain what penectomy is.
Penectomy, unfortunately, is removal of the penis, and it can be radical. Yes. And that doesn't come back, and it's certainly there's no substitution. So why do that if we can cure it very simply by treating you locally? But again, not showing something that is growing. A wart, for instance, can be a cancer. It looks like a wart, and it can be inside the urethra, and you could have all of a sudden a urine stream that is no longer smooth but kind of a spray. That could be a sign. Or let's say if you're not a circumcised gentleman, then in between the skin and the foreskin and the gland or the head of the penis can become an area where this can be. And again, highly curable if gotten early, and you don't have to go through a massive and horrible surgery. So, I have written on this topic. It is not a common thing in the United States. It is more common elsewhere. But because of the HPV situation that is growing, you can get it, and it can become quickly disseminated, and then we're looking at a very massive surgery and lower chances of cure. So again, doing an exam, looking at your penis, making sure that there's nothing that is changed, or a freckle that is growing, or the stream that has changed, anything like that, growing nodes need to be looked into.
So does testicular cancer, will it spread to other glands or lymph nodes? Or?
In fact, it often spreads. It is almost more common for it to spread than not to spread. But even if it goes into the brain, it is highly curable. In fact, the very famous bicyclist Armstrong had cancer that actually spread to the brain, and he was cured 100%. So again, these are highly curable cancers, but why go through all of that if it can easily be treated with an orchiectomy, and it would be singly. Now, why is it caused? This is why bicyclists, please listen to me. The testicles near your body, when there's something tight because you are doing some kind of exercise, or you like tight jeans or whatever, is going into the testicles are too close to your body heat. And testicles do not like heat. Then testicular cells transform into cancer because they're getting exposed to heat. Now, when you have children and you don't see that the testicles descend, already within a year they should be in the scrotum. If they are not, they need to be brought down, because heat will produce cancer. So anything you're doing to your testicles that will produce heat to them, they don't like.
Hot tubs. What about
hot tubs? Anything.
Really? Yeah.
Absolutely. Heat. In fact, actually, heat is a very important part of cancer and also of embryologic abnormalities. A woman that is pregnant in the first trimester should never get into a hot tub, because any cell that is dividing, like the sperm divides very often freshly, so that you have, unlike a woman has their ovums from birth. That's why women after a certain age should not get pregnant. Why? Because those ovums have been there for 50 years if they're 50. Well, men make fresh sperm, in a serial fashion, but any cell that is dividing can then go into a cancerous form by heat.
That's just so fascinating. Is there anything else you wanted to add about, these kind of cancers here specifically with men, or highlight something else?
I want to add that for some reason men feel that it is not important to be their own advocate, and this is just not so. Please be your own advocates, part of their wellness. Insist on the exam, or yourself bring it up to your doctor. There's no problem, and the tests are easy and they're not painful. Usually it's an ultrasound or a CAT scan or a blood test. Actually, most of these can be picked up by a blood test. How easy is that?
Too easy. Doctor, thank you so much. Well, we appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care offers complete cancer care, all under one roof, so there's no need to travel far for the best in care. Whether you need radiation or chemotherapy, access to clinical trials, financial counselings, other supportive services for yourself or your family, maybe even just a second opinion, Central Care is here for you. You have a choice. Bringing that expert care to you is an important component in the success of your outcome. In fact, being surrounded by your family, your friends, that can be the factor that elevates your treatment. Feel free to reach out by calling 800-592-5110, or you can visit us online at cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.